Hello and welcome to the November 2020 edition of World Health Report with your host, Dr. Bret Palmer. We'll start off with COVID, as that's continually spreading worldwide, and as you can see from the cumulative cases from November, you can see there's quite a steep rise, that it really is taking off again as we approach winter. And the reason why of the steep rise in increasing cases is simply because the majority of the population live in the northern hemisphere and it's becoming winter, and so the virus sticks around more easily. We'll come on to more of that later. And if we go back to May 2020, there was around about 4 million confirmed cases spread evenly around the world. But as the months have gradually gone on through July and October, up to 35 million, and in November there's over 53 million cases with a global death toll of 1.3 million. Before anyone writes in or asks, the global deaths are number of individuals that have been picked up and die either directly because of COVID or have died with COVID. It does seem to be quite a mix of individuals. Either way, COVID does appear to have contributed to their death in some form or other, and because of that, it's putting a lot of pressure on health systems around the world. Either way, the virus will continue to spread, and partial lockdowns unfortunately probably won't halt it. However, we're not even at winter yet, and we'll probably have to wait for the temperature rise in spring in order to have any significant impact on cases not spreading while not locking down. For those there have been lots of papers out there which say there's no correlation between the rise in cases and the temperature. Well, having a look at and using the UK as an example, the first time there was an outbreak, which is back in March, April, May, there was a significant body of cases, and they started to decrease effectively in June, when the temperature was above 20 degrees in terms of the average daytime temperature. As we progress through the year, the cases never went fully away, because obviously people were still out socialising after dark and at night time, because it's the UV radiation that can kill off coronaviruses very quickly in a couple of minutes. But when the temperature dips below 20 degrees, as in September, cases start to significantly increase again and really get hold in October. And so effectively it is seasonal. In the winter, the sun is obviously very weak, and so COVID can settle on surfaces quite successfully and be transferred more easily, and even in the open air it can be transferred far easier. And that is why I always say wear a face mask when you're outside in a crowded place. You should only take your face mask off when you're indoors at home, or when you're outside when there's no one around you. So if you're walking down the high street, you should probably wear a face mask as well. So who's more at risk of COVID-19? Well, male, increasing age, and any disease that seems to affect the blood vessels. Type 2 diabetes, obesity, kidney disease, cardiac disease, liver disease, and smoking also exaggerates all of these diseases as well. And people who suffer from the severe symptoms of COVID do seem to be old male smokers. In terms of the long-term effects of COVID-19, you can see a long list there, which I'm not going to go through, but some very long ones are chronic fatigue, cardiomyopathy, myocarditis, pericarditis, and shortness of breath. Now, the research is still going on. This is a fairly new disease going around there. We haven't even had it for, well, we've had it for about a year, I suppose now, worldwide. And so there'll be lots more research done on the long-term sequelae or prognosis of long-term COVID, and see how long it sticks around. So in terms of to lower your personal risk, wash your hands frequently, wear a face mask even outside where you think you may be safe. If you're walking down the high street, or you can count more than 5 people in relatively close proximity to you, you should be wearing a face mask. Keep your distance however best you can, and try to keep in a well ventilated area as best you can, and obviously have the decency and courtesy that if you have an ill or a cough or a slight temperature or a fever, you stay away from others and keep it to yourself. You don't just battle on and visit Gran, for example. And obviously work from home if you can. We have to learn to live with this, and the best way to do it is to lower your own personal risk, and that will automatically lower others around you. In terms of the vaccine, well, vaccines are actually starting to be discovered, which is fantastic news. It happened a lot quicker than I thought it would. However, a word of caution, though the Pfizer and the Russian vaccine both give responses or effectiveness above 90%, we do not know the antibody response to the vaccine in terms of how long it will last. Will it last for just 1 month, 2 months, or will it last a few years? Both of them are quite important factors to know. And more importantly, will it affect the vulnerable elderly? These are the elderly that actually have comorbidities, and they are the ones who are most at risk. Would it actually protect them? In terms of the Danish COVID mutation, there's 214 cases of this particular mutation, and they've been identified in Denmark, and it's associated with mink farms. But however, you have other mutations as well as this mutation also identified in mink farms in the Netherlands, Spain, and also in America, I believe. And so there are 12 cases that have a unique variant, but chances are the variant is probably already in the human population and already in other animals as well, possibly rats, for example, as well as maybe pets, and so it will spread. It doesn't mean you get rid of your pet, because your pets are going to be more at risk of humans, not the other way around. But what it means is it's probably already spread and it's already in the human race. It's only a matter of time. Does this render vaccines ineffective? No, it doesn't. It's all a question of, does these variants change the spike protein? Now, obviously, the more times you vaccinate people, even the vaccine is proven to be effective, that sees an evolutionary pressure on the virus, which may push the virus to change its spike protein in itself. However, this is at the moment very theoretical. We have to see what happens over time. We also have to remember as well that viruses have usually tend to become less pathogenic over time. The reason why I say this is because there does seem to be a reduced mortality rate with COVID as time goes on. Why is that? Well, it could be we're just finding more cases. It could also be doctors are getting better at treating COVID, and also because of the various lockdowns and people being aware of taking precautions, intensive care units are not actually being overwhelmed, and so people are getting the treatment they require and are not necessarily dying unnecessarily. And as time comes on, the virus obviously will continue to mutate, but with all viruses and other pathogens around the world, when they mutate, they tend to mutate in our favour. In other words, they become less pathogenic. Has this happened just yet? It will be a bit quick, in my opinion, because HIV is less pathogenic, but that's taken decades. Ebola has become less pathogenic, and that's taken decades. Still very, very dangerous viral infections as far as we're concerned, and it will take centuries before they become harmless. In terms of COVID-19, how quickly can it mutate to become less pathogenic? We unfortunately have to wait and see, and that could take many, many years before we get a proper answer to that one. So hopefully the vaccines will come along much sooner. So should we lock down? The only reason to lock down is to avoid collapsing the health services. But we have to remember lockdowns can cause harm to mental health, the general health, as well as the economy. And lockdowns will become lighter with time because of the harm it does to the economy, general health, as well as to mental health. There are obviously a list of other pandemics, for example, influenza, TB, malaria, measles, to name but a few. And there's various episodes where I've gone through some of these, which I'm not going to go through today. For the 4 sexual diseases below, HIV, syphilis, gonorrhea and chlamydia, please see my Explain series channel on that one, please. Thank you. In terms of other diseases, outbreaks, the Ebola outbreak has been bubbling away since June 2020. So this is a new outbreak that started in June, and it is unfortunately in an area where there is armed conflict and other diseases affecting this central region of Africa. So it is expected to spread. And obviously in North America and Africa, the measles pandemic is still continuing, which is a vaccine preventable illness. So I would generally encourage everyone in North America, and if they can get it in Africa, to get the MMR vaccine. There has been an outbreak of the Oropouche fever virus disease in French Guiana, and this happened in September. There's been about 37 cases. Now, the incubation period for Oropouche fever is around about 4 to 8 days, and it tends to include a sudden high fever, headache, rash, myalgia and joint pain, and the illness generally lasts for no more than 6 days, but you can get a reoccurrence of symptoms in 6% of patients. This is obviously confusing the diagnosis of COVID patients in French Guiana. Also in French Guiana is the Mayaro virus, which has happened in October, and they've got around about 13 cases. Now, like a lot of other alpha viruses, which Mayaro virus is, you can get complications in a small number of cases in terms of neurological complications, myocarditis and even deaths, but it's usually is a self-limiting virus for no more than about 5 days, but you can have persistent arthralgia which can remain for various weeks and months. In going back to West Africa, in Mauritania, there is an outbreak of Rift Valley fever, and this is an environmentally driven mosquito-borne zoonosis that usually only affects animals which are generally farmed, so goat, sheep, cattle, and in West Africa, camels as well. And so normally human beings aren't the natural host, and we only get outbreaks where there's lots of livestock. So generally farmers tend to be the ones most affected. Now, usually it has a very low mortality rate of around about 1%, but there has been 8 cases and 7 deaths. So it would, to me, this would say that there is far many cases that have yet to be discovered with this particular virus. If we find any more information out, I will let you know. Moving on to other things that affect human health in terms of the current conflict zones, not much has changed on the board behind me, but in one conflict that has suddenly arisen is the breakdown of the peace accord between Ethiopia and Eritrea, which is on the so the conflict is happening on the southern border of Ethiopia towards Eritrea. Last time these two countries and regions were at war, tens of thousands of soldiers unfortunately died, and it looks like this escalation of violence will continue, most likely to a full-blown war, unless the old men in charge actually decide to talk to one another. In terms of other extreme weather events, there has been an earthquake over the last 2 weeks in Turkey, and that has caused a number of deaths. In terms of, there's been a number of other earthquakes, but the only one that has got to a magnitude of 6 was in Tonga on the 11th of November. There has been other cyclostorms, Theta in the Atlantic, which is dying down as it gets closer to Europe, but you've got Eta, which still is a very strong storm on the east coast of America, and also Iota, which is around the Caribbean, and that's causing quite a lot of flooding for all countries around Central America and the Caribbean region. If we go over to the Pacific, on the east coast of China, there is Vancouver or Vanco cyclone, which obviously is causing quite a lot of damage and very strong winds of over 200 kilometers per hour. There is a couple of droughts occurring, most notably Algeria, which is a fairly long-standing one in North Africa, and also in central Argentina as well, which is actually, that's a longer one of around about 70 to 80 weeks. There are no current incidents. In terms of going further afield to things that affect human health in terms of space weather, luckily enough the sun is behaving itself, there's no significant activity, there's only 2 decaying sunspots, and there's no coronal mass ejections heading to Earth, and the radiation and solar wind are very low. In terms of near-Earth asteroid, there's only one to highlight, and that will be with us at the 1st of December, but nothing really to worry about. It's a very, very small asteroid, only 6 meters, and it's travelling very slowly for an asteroid at around about 4 kilometers per second. So it is travelling very, very close, but even at 0.1 lunar distances, it will probably miss us. This asteroid, even if it does hit us, will probably not even reach the planet's surface on account of it only being 6 meters. In terms of the economic outlook, unfortunately for the rest of 2020, it looks bleak, with many countries staying in recession and with a negative economic output. This obviously then affects the amount of money you have for your health service and for your education, and also then affects the mental health and other factors affecting human health a great deal. And a lot of this has been caused by lockdowns, unfortunately. So if we can get on top of the lockdowns by getting on top of the COVID-19 virus, then hopefully the economic outlook for 2021 may slowly improve. These are some of the websites I've used to put this episode together, and I hope you enjoyed it, and thank you very much. And please remember to look at my Explain series channel, which deals with sexual health infections and sexual health diseases. Please like, subscribe and share, and thank you very much. Take care. Goodbye.